In the medical healthcare system, sickle cell anemia is a genetic disorder caused by a single missense mutation that turns hydrophilic glutamate into hydrophobic valine on the beta globin chain, thus making hemoglobin S. Hemoglobin S is unstable and easily polymerizes, causing red blood cells to become crescent-shaped, aggregate together, and undergo hemolysis. This all leads to acute and chronic lifelong symptoms. This is one of their stories.
I've never seen anything like this, Stabler.
Me neither, Benson. A missing child, 2 dead parents, and no leads to go off of.
The tech said there was something weird about the blood left at the crime scene. Some of the blood under the microscope looked like a donut, and some of it looked like a crescent. The kid may have sickle cell anemia.
Sickle what? What are the odds of all this?
Actually, sickle cell anemia is the most common inherited blood disorder in the US. It affects up to 100,000 Americans. In fact, 1,100 to 3,000 infants here are born with sickle cell annually. Across the globe, around 7.74 million people suffer from sickle cell anemia. Heterozygosity for the sickle cell mutation provides protection against severe forms of malaria. So a lot of those with sickle cell have ancestry from areas where malaria is common.
I meant, what are the odds of the murder, smart guy? I know this kid may have sickle cell, but our perp is the real sick one that belongs in a cell. But how is this going to help us find the kid?
If we can confirm that the kid has this disease and learn more about their symptoms, it might help us find them. If this kid's sick, we gotta find him fast.
So, we need to learn more about sickle cell anemia? You know where we have to go. Dr. Sloan? Dr. Gray? We've been looking everywhere for you.
We're doctors. We're busy. Anyway, the tech was right. This blood sample shows that the kid has sickle cell anemia, meaning the parents were obligate carriers.
What do you mean the parents? They didn't show any symptoms.
Sickle cell is passed down from parents to children. Every person has 2 copies of the hemoglobin gene. It could be the dominant non-symptomatic allele, hemoglobin A, or a recessive mutant allele, hemoglobin S. With someone who has sickle cell, the individual receives 2 copies of hemoglobin S from each parent, since the disorder has an autosomal recessive inheritance pattern. If the parents weren't affected symptomatically by sickle cell, they must have been heterozygous.
Dr. Gray is right. Carriers have sickle cell traits, so they have 1 copy of hemoglobin S and 1 copy of hemoglobin A. That's half affected and half unaffected red blood cells, which is enough for them to not have any symptoms unless they're in high altitudes or severely dehydrated. There was a 50% chance that the child would have also been an unaffected carrier, a 25% chance that they would not have been affected at all, being homozygous unaffected, and only a 25% chance that they would have inherited sickle cell.
Dr. Gray, there was a plane crash and all of our doctors were on it.
Oh no, let's go. Bummer. We're on our way. The kid's been found. They're asking where we should send him.
To the least professional doctor we know.
Our house.
What now?
Another request from Graceland Memorial.
Those idiots wouldn't even know their stethoscopes from their elbows. What do they want our help with now? Another case of syphilis?
No. Well, they have a child with possible sickle cell. They want our help confirming diagnosis.
Number 3. What are the symptoms of sickle cell?
Sickle cell anemia causes a change in the shape of red blood cells, which reduces their lifespan from 120 days to 10 to 20 days. It causes red blood cells to become more sticky and rigid, which leads to vessel blockages known as vaso-occlusion, hemolysis, and symptoms of ischemia.
Guess you're not as useless as you look. What else, number 2?
There's a wide variety of clinical symptoms across multiple systems that are associated with sickle cell. Babies can be symptom-free for the first 6 months of life with their own supply of fetal hemoglobin. However, once they get older, they are often diagnosed with anemia due to the hemolysis. They can also experience sickle cell crisis, which is a sudden episode of excruciating pain that can last hours to days.
The same excruciating pain it takes to deal with you. Anything else to add, number 1?
Well, over the course of their life, they can develop strokes, headaches, fatigue, extremity swelling, frequent infections, and delayed puberty, among other things. Clinical symptoms can vary depending on patient health and extraneous factors.
So what you're saying is, you don't actually know if this kid has sickle cell just based on those symptoms. As usual, I have to do everything myself. Number 3, what are the diagnostic tests for sickle cell?
The most common tests are chorionic villus sampling and amniocentesis.
Number 2, why is number 3 an idiot?
Because that testing is in utero, and this kid's already born.
So then what do we do, number 1?
You can test for sickle cell in a child or adult through hemoglobin electrophoresis, a CBC panel, reticulocyte count, and a peripheral blood smear.
So go already, what more do you want? A pink wonderland?
Watch me dance, dance the night away.
Hi, doctor. Hi, doctor. Hi, doctor.
Hi, doctor.
Hi, doctor. The case has been solved. The killer is in jail. The child is going to live with their grandparents, and now I'm going to treat them so they can live a long and happy life.
The only known cure for sickle cell anemia is a bone marrow transplant, which I can do. Otherwise, the disease requires lifelong treatment. The standard of care is hydroxyurea, which reduces the frequency of pain crises by increasing hemoglobin F and decreasing vaso-occlusion. L-glutamine can also help treat pain crises and acute chest syndrome. Blood transfusions can be used to increase the number of normal red blood cells. Penicillin is also given throughout the lifetime to reduce risk of infection. Plus, voxelotor can inhibit red blood cells from sickling and binding together.
And there's so many other treatments that can help manage these complications. It's wonderful. Once again, medicine has saved the day.
People have died, Barbie. Maybe cool it with the enthusiasm?
Right, sorry. But that reminds me, those with sickle cell anemia have a life expectancy shorter, 20 to 30 years compared to normal adults. This is why prenatal and early diagnosis is so important. Providing treatment early can help prolong survival, and that is why it's important to know about sickle cell anemia. And that's everything. Goodbye!
Life of blood fragility.